On the 17th of March 2012, Fabrice Muamba collapsed on the pitch in an FA Cup game playing for Bolton Wanderers against Tottenham Hotspur. It first appeared that he had collided with Luka Modric whilst in the air, but later it became aware to everyone that something was very wrong with Muamba. Muamba had a cardiac arrest and received emergency treatment with medical personnel on the pitch, and fortunately with a cardiologist in the crowd, was able to be transported to a tertiary coronary care unit to receive specialist attention. If you don't know me already, my name is Matthew Faisa and I'm a medical student from London interested in sports medicine. This video was recommended by a subscriber who wanted to know more about the injury and the science behind why Fabrice Muamba had the incident. If you want to join the sports medicine community and also continuously contribute to this channel and the videos I make sure to subscribe. We have a lot of new subscribers in the last 30 days, however there's still about 80 to 90% of you that are still not subscribed, so make sure to drop a like and also subscribe so you don't miss out on any videos in the future. There are different dimensions to this injury, so I'm trying to approach it systematically. Firstly, let's talk about the function of the heart and then go into the underlying diagnosis of Fabrice Muamba. The function of the heart is to pump blood all around the body to respiring cells, tissues, organs and muscles that require oxygen. The brain as an organ hosts the cells that require the most amount of perfusion and as a result have the highest oxygen demand of all the cells in the body. Let's also speak about the vessels. Arteries are the vessels that carry blood away from the heart and typically carry oxygen. Alternatively, the other vessels are known as veins. Veins are blood vessels that carry blood to the heart, and this typically is deoxygenated. This might sound a bit confusing, however if we look at the heart we can see that blood goes in a circular motion coming in from the atrium, proceeding into the ventricles and they're being pumped out. This occurs on both sides of the heart. Many might not know this, but the heart is surrounded by cardiac musculature which, like many other cells in the body, requires oxygen to work. The main artery of the heart is known as the aorta, however there are smaller arteries which diverge of the aorta in various directions, and these are known as the coronary arteries. The coronary arteries are the arteries directly responsible for supplying the heart cells with oxygen. The right and the left coronary arteries supply different vessels and different cells of the heart depending on its position. In the general population, if a heart attack arises from any of these vessels being obstructed, typically it would be due to increased fat levels and deposition into the lumen, which is the hole and the pathway through vessels, causing an obstruction and reduced blood flow to the cells in the heart which require this oxygen. These are known as atherosclerotic plaques and be quite devastating with the potential to leading to heart attacks or heart failure if it's not correctly managed. Like any other parts of the body, the cells of the heart are no different. The cells in the heart, if not correctly and adequately supplied with oxygen, will die, and these occur in a three-step process of inflammation, necrosis, which is another word for death, and fibrosis, which is referred to as the thickening of these cells. The fibrosis stage is very important as typically a month after these cells have died due to an inadequate supply of oxygen, they form a scar. This scar is very tight and results in decreased function of the heart. When there's a scar, that portion of the heart cannot contract and cannot relax to help pump blood around the body. As a result, other muscles of the heart have to pump harder and work at a higher rate to kind of compensate for the reduced function of that region. And much like any other muscle in the body, such as the biceps, the legs, when you keep working it harder and harder, what does it do? It grows and it hypertrophies, leading to an enlarged heart. Unfortunately, the heart is unique in the sense that a bigger heart or a larger heart is not beneficial. This ties in with the underlying condition that Fabrice Muamba suffered from. Muamba suffered from hypertrophic obstructive cardiomyopathy, also known as HOCM. HOCM is caused by the inheritance of abnormal genes that code for the abnormal growth and enlargement of the heart muscles. So in Fabrice Muamba's case, he would have been born with abnormally thick walls of the heart and as a result would have had a decreased function. This typically is very hard to diagnose as it doesn't present itself very easily. Unlike in the general population, where enlarged hearts are typically a result of coronary heart disease and early heart failure, in Muamba's case, he had an asymmetrical septal hypertrophy causing outflow obstruction of the left ventricle, which is the chamber prior to the aorta, which is responsible for the distribution of oxygenated blood from the heart to the rest of the body. HOCM is one of the most significant causes of deaths in athletes, with equal representation across all races and from men and women. Also, you might want to know, it is the most common genetically transferred cardiomyopathy, which is another word for cardiac abnormality. So you might be thinking, how does this affect Fabrice Muamba directly? Well, a lot of patients with HOCM have a reduced diastolic function. What this means is that their heart cannot relax adequately enough for it to fill. This is a direct result of having thickened muscles that are either too contracted or too relaxed and floppy. This completely distorts the function of the heart and on a wide scale level leads to a reduced perfusion in areas such as the brain and other parts of the body due to a reduced volume of oxygenated blood being pumped out from the heart. This may lead to pathologies such as ventricular arrhythmias, which is when the heart beats infrequently and in random patterns, or also sudden death, which Fabrice Muamba was nearly susceptible to. After the heart attack on the pitch, where Fabrice Muamba received medical attention, his heart did in fact stop for 78 minutes, so it is a complete miracle that he is still here today. These conditions are very hard and difficult to diagnose, so there is no one to blame as such. However, looking into the future as we continuously try and improve the safety for athletes, I think more of an emphasis needs to be placed on cardiomyopathies in the transfers and medical signings that clubs do. 2 weeks after the incident, Fabrice Muamba was seen sitting up in his hospital bed and smiling. When he was in hospital, they fitted something called an ICD, which is an internal cardioverter defibrillator, which, like a normal defibrillator which shocks patients, this internally shocks the heart when it goes astray and it beats out of rhythm. Upon medical advice from his doctors in Belgium, Fabrice Muamba followed their advice and decided to retire in August 2012 due to the fatal risk and potential consequences of continued playing with this condition. I hope this video proved insightful and a good learning opportunity as always on Fabrice Muamba's HOCM disorder. This injury is well documented, however sometimes they don't go into the adequate detail and they think it's just a heart attack and nothing underlying. And so I hope it was a good learning opportunity. Also, make sure to subscribe to the channel so you don't miss out on any videos in the future. And in the meantime, check out my last video on David Bust, who had a severe leg break which then got infected with MRSA and nearly caused him to die. As always, in the comments down below, make sure to recommend me other players to cover, and I'll try and make them videos in the future. If you have any questions for me, comment down below. And apart from that, I want to say thank you for watching.
Was melanin, coarse hair, coarse my skin, soy sauce, I'm boisterous. I bun with your babes and feed the oysters. Oysters man think that they're hot like raw mustard. More time is sweeter than sponge cakes and birds custard. Fix your posture. I must have been 16, another cube buster. In co-op they had told me about the custer. Wasting time instead of grinding harder than you can, you muster. Bye bye the rules of stacking notes and making bands of sorts of. I think there's some